I'm back. I'm during the break. A lot of things going on. I'm talking to Michael. We're picking our bump music over here. I was just taking an online quiz. Michael, I'll start with you over here. Do you have sinus problems?
Nope.
Nope. I don't think I do either. But I'm taking. I'm on the. It's a website called AmericanSinus.com. There's a sinus symptom checker. Apparently, this is a time where sinuses start acting up. And I'm starting with. I don't think I have sinus problems, but I'm going to get an online diagnosis right now because there is a facility called the American Sinus Institute, brand new. And guess what? It is right here in Houston. The gentleman who runs that entire shizo, his name is Dr. Vincent Honrubia. I know he's been busy because he's getting ready to open this. Dr. Honrubia, does everybody have – do I have sinuses? Everybody has sinuses. Is that right?
That's correct. Everyone does have sinuses. They have 8 separate sinuses in their head. That's correct.
But some people just don't have sinus problems. That's the issue, right?
That's the issue that a lot of people have different symptoms that they don't always connect to the sinuses. They don't know that this may be a sinus problem, so they're unaware that the sinuses are causing the symptom.
I'm on the website. I'm starting to. It's very simple. I love the website, AmericanSinus.com, and I want everybody to go check it out. And I'm playing the quiz right over here. So it seems to me so far, I didn't finish it yet, that I don't have a sinus problem. But all my life, and just like I was asking Michael, my producer, I don't have a sinus problem. You don't have a sinus problem. Technically, could we have sinus problems if we think we don't?
That's true. You could have a sinus problem, and sometimes it masquerades as symptoms like facial pain and headaches, inability to sleep, ear popping, ear pressure when you're flying in an airplane. Things like this that people don't always connect to their sinus is something that we want to get the public to know. Hey, you don't have to have headaches all the time. You don't have to have problems sleeping. You don't have to be snoring. These are the types of things that happen to people. They don't always connect as a sinus symptom.
Uh-oh, I think I have sinus problems. Already diagnosed by the great doctor here on the radio. I'll tell you what, you've made it in life when there's a medical procedure named after you via Tommy John, but there's actually a procedure called the Honrubia technique for balloon sinuplasty. Tell me about that and what differentiates that from your competition.
Well, what we've developed is we've worked with Johnson & Johnson to develop a special small balloon to go into the sinuses and open up the natural openings in your sinuses. So some balloons go into sinuses, but they don't go through the natural openings. And when the device we've developed with Johnson & Johnson and utilize in our clinics is able to enter the sinus through its natural opening. And that's really the critical point of what enables us to fix your sinuses in the office in a 20-minute procedure that allows you to go back to work the same day with little or no bleeding, no packing, very little trauma, little downtime. It's all about going after the natural opening of the sinuses and doing a minimally invasive modification to your sinus that eliminates these symptoms.
Dr. Vincent Honrubia, he's joining me over here. It's a new balloon sinuplasty named after him. It's called the Honrubia technique. I like that. The fact is you can immediately get back to work the same day. You kind of already ran down some of the symptoms, doctor, but who makes a good candidate for this surgery?
The ideal candidate is someone who's finding themselves going to the pharmacy, buying over-the-counter antihistamines, Allegra, all the different ones now that you can buy over-the-counter, people that are buying nasal steroids over-the-counter, people that find themselves medicating themselves for their allergies, quote-unquote, and find themselves having to spend a bunch of money every month on medications that may or may not fix the problem, but certainly don't ever cure the symptoms. And that's what the balloon procedure does. It actually cures, enables your nose to work and accommodate these allergies that are so common in the Houston area.
You have a number of different locations across Texas and some new ones. Talk about the one specifically here in Houston.
The facility in Houston has just opened last week. It's in the Museum District and is a state-of-the-art facility dedicated to only one procedure. So we just do this Honrubia technique balloon sinuplasty there. It's staffed by a group of local ENTs as well as myself, and it's a place you can go if you have a sinus problem, and it's part of it. It's the only place that we know of that only focuses on sinus disease in the Houston area. So it's very unique and it's very focused.
You know, I'm a technology guy. This is kind of the gist of my show, and I want to talk technology as it relates to your industry. How has the technology changed the operating room in your industry?
This is crazy stuff. We're talking about the way we find these sinuses with this instrument is based on light technology, and there's a wire that has a light at the tip 1 millimeter in diameter. That 1 millimeter wire with a light is placed through the nostril into the natural opening of the sinuses, and then it transilluminates the skull so you can see that the sinus has been entered correctly with the wire. Once you have, for instance, the sinus above your forehead, once you're in the frontal sinus, the white has been threaded through the natural opening. It illuminates the head, and then we bring the balloon over the wire, and we blow up the natural lining of the natural duct that opens the sinus. So we're finding spaces in the skull that are sometimes even less than 1 millimeter wide, and enabling us to make the opening 6 millimeters wide. So we go from a opening that's not correct to the 6 millimeter natural opening that God gave us. You're supposed to have a 6 millimeter opening in your sinus, and a lot of people don't have that. And that's why they have the symptoms of pressure, pain, drainage down the back of their throat. They can't breathe properly. They can't sleep properly. So it's pretty cool. I mean, this is pretty cool technology that we're doing. It enables us to compress tissue with your nose versus the old surgery that a lot of people have heard about, where you remove tissue from the nose. By removing tissue from the nose, you create bleeding, scarring, you need to do packing, you need to go into a hospital or a surgery center. By using the technology that Johnson & Johnson developed and modifying it the way we have with the Honrubia technique, you're able to compress the tissue so you end up not losing any of your tissue. You just end up with your nose rearranged in a way that it functions better.
Do sinus issues, I think, correct me if I'm wrong, do they happen at certain times of year? Because people always start sneezing and wheezing when the spring comes and the pollen. You know, obviously we're in the winter season right now. Is this a year-long thing, or are there seasons that are worse than more?
It's a year-long thing. The allergy symptoms vary depending on what you are or not allergic to. And some people get worse and better depending on the season. But other times, people have these symptoms all the time. They just maybe have more of the symptom, but they're never symptom-free. So we want to know and tell people, listen, if you're not happy with the way your nose is working, if you can't smell properly, if you can't breathe properly, if you can't sleep properly, come see us, and maybe there's something we can do to modify your nose using these small balloons that will enable you to function better and live a better life.
Last question before I get you out of here, because I do appreciate your time. I'm looking at some of your offices around the entire state of Texas. Obviously, your new one in Houston that just opened in the Museum District. I see you're in San Antonio. I like this. You are the official Sinus Institute for the San Antonio Spurs. That's strong, man. That's pretty good. That's pretty good. So
That's right.
So you have San Antonio locations. What other plans, expansion do you have across our great state?
What was the question? I didn't hear.
What other expansion plans? What other cities do you plan to get across?
Our next city will be Austin. And we're planning on being in Austin probably by mid-February. And then after Austin, we're going to head up north to Dallas, Fort Worth area, and try to keep expanding throughout the state to provide this kind of care to patients all throughout Texas. Standard care that where they go into Dallas, Houston, San Antonio, wherever they go, they get the exact same procedure with the exact same result.
Well, I'll tell you what, when you get to Dallas, do me a favor. Could you at least become the official Sinus Institute for the Cowboys? Because they need help on every front right now. And as a Cowboy fan,
they need some balloon surgery, the Cowboys. I agree.
As a Cowboy fan, they need a lot of help. You know what? You're Austin. Help my Longhorns out, too, Doctor. I will take any help that you can. Any help. His name is Dr. Vincent Honrubia. AmericanSinus.com is the website, and it's called the Honrubia Technique. Absolutely probably should be the first place that you call if you have issues. Doctor, thank you so much for calling, and congrats on your success, and keep me updated with everything you guys got going on.
Well, thank you for having me. And then one last thing, if anyone wants to call in, we do have some operators standing by at 713-BALLOON, and that's our number in Houston. It's pretty easy to remember, 713-BALLOON.
I like
that. Very much.
713-BALLOON. Very good. Thank you very much. Okay, good. Well, now that I know I may have a sinus problem, I need to make an appointment of it. I'm a sneeze. See, that's the old doctor issue that I have. Thanks to Dr. Honrubia. All right, we got a break here over on the Michael Garfield High Tech Texan Show.